Good evening, I'm Cynthia from Surgery Tutorial Videos and welcome to today's discussion. Today we'll be talking about surgical site infection. The outline for our discussion includes definition, classification, criteria for definition, risk factors, management, and prevention. Surgical site infection is defined as infection present in any location along the surgical tract within 30 days after a surgical procedure is done, or up to a year if the procedure involved the use of implants or foreign material. So, any infection occurring along the surgical tract. The surgical tract includes the line of incision that was made up to the space or organ where the operation was carried out on. So, the surgical tract includes the skin, the subcutaneous tissue, the muscle or fascia, then the organ space. So the part or the tract that was breached by the surgical blade is the surgical tract, and then the organ space that was operated upon. So any infection occurring in any of these locations is defined as surgical site infection. And then when it involves the use of implants, for example in orthopedic surgery where plates and screws are used to immobilize a fracture healing to occur, any infection occurring in such a site where an implant was used up to a year after the surgery is defined as surgical site infection. So let's take note. Within 30 days after a surgical procedure is done, when no implant is used, and then it could extend up to a year when an implant is used. So classification of surgical site infection. We have incisional surgical site infection and then organ space surgical site infection. That is the broad classification. For incisional surgical site infection, it is further classified into superficial and deep incisional surgical site infection. For the superficial incisional surgical site infection is that affects the skin and subcutaneous tissue, while the deep incisional surgical site infection is that affects the fascia and the muscle. There is another classification that includes type 1, type 2, type 3, and type 4. In this case, type 1 involves infection of just the skin only. So when there's infection of the skin only, it is described as type 1 surgical site infection. While type 2 is when the subcutaneous tissue is affected. Then type 3 is when the fascia and muscle is affected. And type 4 is when there's organ space involvement. So we have two forms of classification: the broad classification into incisional and organ space. So incisional is just the path along which an incision was made. So it could be superficial or deep. When you make an incision, you're definitely going to pass through the skin. So the layers you are going to pass through before you get to the organ space constitutes the incisional surgical site infection. So superficial is that involves the skin and the subcutaneous tissue, while deep involves the fascia and the muscle, and then you have the organ space. While type 1 involves the skin, type 2 subcutaneous tissue, type 3 deep soft tissue, that's the fascia and muscle, while type 4 organ space. So this diagram would help us to understand the two various classifications. So please take time to study the diagram closely. So criteria for defining an infection as superficial surgical site infection. So besides the infection occurring within 30 days after the procedure is done or within a year when there is use of implants, the infection has to involve the skin and subcutaneous tissue adjacent to the incision, as we have earlier established. Then at least one of the following symptoms and signs may be seen. So you may have a purulent wound discharge from the incisional site, and then there may be florid signs of inflammation like pain, tenderness on the side, temperature, redness, swelling. Then there may be spontaneous wound dehiscence or a deliberate opening by the surgeon following the symptoms and signs seen at the incisional site, and then a diagnosis made by a surgeon or attending physician based on the symptoms and signs a patient presents with. So when a patient meets any of these criteria, you say there is superficial surgical site infection. So when do you say surgical site infection is deep surgical site infection. So besides it occurring within 30 days after the procedure, it involves the soft tissue, that is the muscle and fascia. And then you may see at least one of the following: purulent discharge from the wound, from the incisional wound, and then you may isolate an organism when you take a culture. Then you may see facial dehiscence. There'll be facial dehiscence or a deliberate opening of the fascia by the surgeon due to signs of inflammation. Then a diagnosis made by a surgeon or attending physician based on the clinical signs and symptoms the patient presents with. So the criteria for saying an infection is deep surgical site infection is inclusive of all we have said before, and most importantly, facial dehiscence or a deliberate opening of the fascia due to signs of inflammation. So you may see purulent discharge in deep surgical site infection. You may also see it in superficial surgical site infection. But when you see facial dehiscence or a deliberate opening of the fascia due to signs of inflammation, you suspect a deep surgical site infection. So organ space surgical site infection. This infection that occurs within 30 days after surgery. The infection is in the organ or space other than the incision which was opened or manipulated during the surgery. Then at least one of the following is seen: purulent discharge from a drain placed in the organ or space. So unlike incisional surgical site infection, you will not see the purulent discharge on the surface. You only see it when a drain is placed in situ in the organ or space. Then when an organism is isolated from a culture sample aseptically collected. Then diagnosis made by a surgeon or attending physician based on clinical signs and symptoms. So here the infection is in the organ or space that was operated upon. For example, if it's the gastrointestinal tract that the operation was done, the space there is the peritoneal cavity. So when there's inflammation of the peritoneum, you have peritonitis. Then if it was the joint space that was operated upon, there's inflammation of the joint space. It's described as organ space surgical site infection. So risk factors for surgical site infection is broadly divided into patient factor, local factors, and then microbial factors. For patient factors, we have age, extremes of age, the elderly most likely, they are most susceptible rather. The immunosuppression, obesity, chronic medical conditions such as diabetes, hypertension, malnutrition, anemia, radiation. So all of these would impair wound healing that will eventually predispose the patient to surgical site infection. The local factors include poor skin preparation before surgery, contamination of surgical instruments, poor surgical technique when the tissues are not handled properly. There may be inadvertent injury to tissues. Then inadequate antibiotic prophylaxis before surgery when indicated. Then use of foreign body. All of these are risk factors for surgical site infection. The microbial factors: prolonged hospital stay predisposes to nosocomial infection that may predispose a patient to surgical site infection. The antibiotic resistance by the offending organism. Then when there's a remote site infection, for example, a patient who has urinary tract infection or a respiratory tract infection, that's why usually any infection in the patient is treated before surgery so as to prevent surgical site infection from occurring. Then the virulence and inoculum of the infecting or the offending organism. Management. So besides taking history, and that's after you've taken your history and you've examined the patient, you take a culture of appropriate specimen. So you could do a wound microscopic culture, that's take a swab for microscopic culture and sensitivity from the purulent discharge. Then you could also do a wound biopsy where necessary. Then drain the purulent material. The purulent material should be drained. Wound debridement where necessary is done. Then sometimes a reoperation may be necessary to relieve the patient. For example, if there are intra-abdominal abscess collections following a surgery, a reoperation definitely has to be done to drain those abscess collection. The antibiotic cover is given. Antibiotics are given based on the sensitivity pattern. Most surgical site infection, especially incisional surgical site infection, are allowed to heal by secondary intention. The second intention, that is by granulation tissue formation. Prevention of surgical site infection includes preoperative measures, intraoperative measures, and postoperative measures. But most importantly are the preoperative measures and the intraoperative measures. For the preoperative measures, shorten hospital stay to prevent patients from acquiring nosocomial infections, and treat any remote site infection before surgery, ensure antibiotic prophylaxis when indicated, treat any comorbid conditions such as anemia. Then there should be tight glycemic control for diabetics. Optimize nutrition for patients because malnutrition can impair wound healing. Intraoperative measures include adequate skin preparation, avoid gross spillage of gastrointestinal contents during surgery, close dead spaces. And there should be minimal handling of tissue, use drains when indicated, then adequate supplemental oxygen during surgery. For post-operative measures, there should be adequate wound dressing, early enteral nutrition. Sorry, that's enteral, not central. So it should be early enteral nutrition. I'm sure we know why, especially if we have seen my video on surgical nutrition. Then remove drains when indicated. Drains should not be allowed to stay for too long. There should be tight glycemic control. So thank you for seeing this video, and I hope you learned a lot from this video. The references include Clinical Surgery Tutorial Manual by Dr. Ernest Udefiagbon, and then Compendium for Surgery Tutorials. Thank you and have a blessed day.